To actual class, let me give you a small note on human body and healing mechanism. Human body is made up of cells like this, almost close to 3 trillion in number. Each cell is an independent, self-sufficient unit. When there is a need to understand human body and healing mechanism better, if there is an injury to human body, like a laceration or burn injury or a small cut injury, we go to a doctor and we receive a TT shot, an antibiotic and a painkiller. Out of these three, which one is actually healing the body? None of the above. TT and antibiotic, they prevent infection from entering through that injured site. Painkiller is to relieve the pain. The actual healing mechanism is innate to body. The intelligent system of healing is actually repairing the body in regenerating new cells and closing down the wound. So holistic nutrition means providing the body with sufficient nutrients and providing the body with optimum conditions for this healing to happen. Usually what happens when a person is suffering with any kind of illness, say for example diabetes or hypertension, the specialists, they start with some kind of medication and we call this as pharmacotherapy. And in some serious cases, they may need surgical therapy, and in end-stage disease, they may go for rehabilitation. Before the start of this procedure, there must be a lifestyle and physical activity change in the patient for these three things to work effectively. And even before that, they should be put on medical nutrition therapy, and emphasis must be made on psycho-emotional and social wellness. These three things are missing essentially in the conventional allopathy practice or the disease management process. Incorporating all these three elements with regular pharmacotherapy, surgical therapy, and rehabilitation makes the treatment holistic. So the purpose of holistic nutrition or holistic management of disease is to help patient in having minimum of pharmacotherapy and surgical therapy and rest of the procedures. Coming to holistic heart nutrition, in our regular practice of cardiology, the common cases we come across are ischemic heart disease. So we come across words like angina, myocardial infarction, PTCA, CAPG, cardiac arrest, and we see some conduction defects, hypertension and myopathies, valvular diseases. What is a valve? What is the function of it? What is the pathology involved, and what are the complications? Congenital anomalies like septal defects, transposition of great vessels, PDA, and what happens exactly in the patient suffering with this kind of diseases, and most importantly, what is heart failure? There is right heart failure, left heart failure, congestive heart failure, and there is shock. And we come across words like cardiac arrest, cardiac failure, heart attack. So the purpose of this class is to understand these words with respect to our nutritional practice. Let's get on with our class, and we'll be discussing functional anatomy and physiology of heart and vasculature and pathogenesis of some of the most common heart cases we come across in our daily practice. The functional anatomy of heart. Heart is a four-walled organ pumping blood to the body. It is made up of atria, ventricles. It has got its own valves and septa, separating these four chambers, separating and connecting at the same time. Heart has got its own vascular supply. It is called coronary arterial system. And finally, it has got its own conduction system also, so that it will not depend upon the brain to send signals to pump or to slow down. And so it has got its own conduction system. We'll see one by one. Atria, there are two atria in heart, the upper two, right atrium and left atrium. The purpose of atria is to collect blood. Right atrium collects from the body. When the body is coming to the heart, it is deoxygenated blood that is coming to the right atrium. Left atrium collects the blood from lungs. So here the blood is oxygenated, so it is depicted in red compared to the blue, which is deoxygenated blood here. From atria, after collecting the blood, these atria pump the blood into respective ventricles. Right atrium into right ventricle, left atrium into left ventricle. So right atrium and right ventricle together are called right heart. So the purpose of right heart is to collect blood and send it to lungs for purification. If you look at the structure, the atrial walls are thin compared to their counterparts, right? Because their purpose is not the actual functioning. It is collecting and sending into the neighboring chamber. Coming to the ventricles, they receive blood from atria, and right atrium pumps it into lungs for purification, for oxygenation. Left ventricle, it pumps through aorta to the body. So if you look at the heart, left ventricle is the main chamber which is doing the actual work of pumping blood. Right atrium is collecting, right ventricle is pumping to lungs. Left atrium is again collecting from lungs. It is the left ventricle that is actually pumping blood to the complete body. Ventricles are separated by ventricular septum. Atria are separated by atrial septum. They are more muscular compared to atria, and left ventricle is more muscular compared to right. So here everything is logical. Atria are thin, ventricles are thick with muscle. Right ventricle, because it needs to send only to the lungs, it is not pumping to the whole body. So it is thin compared to the left ventricle. Left ventricle is much thicker, which is very muscular because it has to pump with a lot of force and energy to the complete body. As we discussed already, the purpose of cardiovascular system is to pump the blood. So the body is sending to the right heart deoxygenated blood. From right heart, it is going to lungs for oxygenation. After oxygenation, it is coming to left heart, and left heart is sending to the body again. So this is a cycle. If you see here, it is a one-way traffic. There is no mix anywhere in these four chambers in the heart of deoxygenated blood with oxygenated blood. And so they are clearly separated by septa, and they are connected by these valves. To achieve this unidirectional flow, the heart has got multiple valves. The function of a valve is to allow unidirectional flow. If you see, this is a tube, and these two levers are like a valve. It is allowing the flow of blood in only one direction. If there is a pathology and the blood is coming back in opposite direction, the valve closes and it will not allow the flow of blood in reverse direction. Let's see what kind of valves we have in human heart. Right atrium, there is incoming from superior vena cava and inferior vena cava. So there must be a valve guarding this inferior vena cava and superior vena cava opening into the right atrium. The purpose of valve is again to prevent backflow of the blood which is coming to right atrium. They are guarded by semilunar valves. And next, there is a common valve between right atrium and right ventricle. It is serving two purposes: right atrium outgoing, right ventricle incoming. So we have a common valve here: right atrium outgoing, right ventricle incoming. Because this valve is there between atria and ventricle, it is called atrioventricular valve. Since it has got three cusps, it is called tricuspid valve. This is a common valve. And from right ventricle, there is an outgoing through pulmonary artery to lungs. It is again guarded by semilunar valves. Right heart is having three main valves. So should be with left heart. There must be left atrium incoming. There is a common left atrium outgoing, left ventricle incoming, and left ventricle outgoing. So right heart and left heart, they are like more like each other. They are doing the same function. So if this side has got three valves, this side also has got three valves. Let's see what they are. As I said, left atrium incoming from pulmonary veins. The blood, oxygenated blood that is coming from lungs through pulmonary veins, opens into left atrium. It is guarded again by semilunar valves. And there should be a common valve, left atrium, outgoing, left ventricle, incoming. And finally, there is left ventricle outgoing. Left ventricle outgoing is by aorta, so it is called aortic valve. Again, it is also guarded by three semilunar valves. Okay, why we need to study these valves? Because if there is any pathology or any disease to any of these vessels, the actual purpose of these valves, that is allowing only unidirectional flow of blood, is compromised. Okay, so don't worry about all these valves. You can play back this video again. Just go step by step and try to understand the process. Okay, don't try to remember everything at once. We'll see the purpose of valves later in our discussion with respect to the pathology. Right. Coming to the septa, atria are separated by atrial septum, this, and ventricles are separated by ventricular septum. Again, why we need to study about this septum? There are some congenital diseases wherein there is atrial septal defect. What will happen in atrial septal defect, or for that matter, ventricular septal defect? The blood will mix here. This is deoxygenated blood. Here it is oxygenated blood. The blood will mix and the body is not receiving pure or complete oxygenated blood. The high oxygenated blood is mixing with this deoxygenated blood and again going to lungs, which means the body is not effectively receiving sufficient oxygen. So the cardiovascular functionality or the cardiovascular capacity of the individual is low, which means they cannot run, they cannot do hard work, or they cannot do physical work, or they cannot play games, something like that, because the oxygen saturation is low in these septal defects. Okay, this is about the chambers and the walls that are connecting and the septa that are separating these chambers. Now, let us go to the conducting system. The purpose of conducting system is to send electrical impulses to the heart muscular tissue so that it will beat rhythmically and consistently and continuously. For this purpose, the heart has got its own neuromuscular tissue innervating the muscular tissue, the heart, and it is made up of SA node and AV node, sinoatrial node. This is called SA node. It is also called pacemaker because the conducting impulses, the conduction impulses, this originate from here. So it is setting the pace for beating of heart. That's why it is called pacemaker. From there, the fibers, they go to atrioventricular node at the junction of this or the upper part of this ventricular septum. From here, a small bundle will come out. We call this bundle of his. From there, the actual fibers, they go to complete ventricles. So we already discussed that it is the ventricles that are actually doing the job of pumping. Atria are only collecting chambers. To beat or to contract the heart muscle, it must be innervated by a nervous tissue. The job is done by this Purkinje fibers. Okay, by electrical impulses of conducting and conducting, that is for contraction and relaxation, is done by this conducting system. Finally, coronary arteries. So coronary arteries means the vessels that are supplying, the arteries that are supplying blood to the heart. I mean, it may look like a bit of paradox because the heart itself is completely filled with blood always. The purpose of blood is to nourish the tissue. When you are full of blood, why you need again a special circulation? So to understand this, let's see the job of coronaries as that of a cashier in a bank. Okay, though he deals with a lot of cash on day-to-day basis, he cannot use that money for his personal needs. He also need to draw his own salary. Like that, the coronaries, the origin of these coronaries is just distal to this aortic valve. From there, the blood is coming to coronaries. So the position, the origin of coronaries is important. And the structure and the distribution of this coronary is also important. Because they are very close to aortic valve, when left ventricle is beating with a lot of force, so that with one beat it is sending blood to the complete body. The blood that is coming into the coronaries is coming with a lot of force. Okay, that is the reason why they are more prone to damage. We'll come to that when we see the ischemic heart disease pathogenesis. So coming to the anatomy of coronary arteries, it is made up of right coronary artery and left main coronary artery. Left main again branches into anterior descending. This is the anterior part. It is anterior descending. The circumflex, it is curving around the back of heart, left circumflex. Why we need to study again the anatomy of these vessels is, if you look at the cases that we see in cardiology, some people may be coming with a blockage of 70% or 80% blockage of LCX or LAD or RCA. That is how the doctors write in their case sheets. We need to go through these case sheets when we are planning diet for post PTCA or post CABG. So this is briefly about the functional anatomy of heart. Let's go and discuss the blood vessels now. The vasculature, the typical structure of vasculature is this. Arteries originate from heart. From there it is distributing or sending blood to the tissues. Arteries divide into smaller arteries, and from there to arterioles, and finally they end up in capillaries. From capillaries, again the blood is collected by small veins, we call them venules, and these venules come together and form bigger tubes, and they form veins. These veins, there are peripheral veins and deeper veins, and finally they are going towards heart. So the actual exchange is taking place here in the capillaries. The purpose of artery is to provide blood to the tissue. It can be like the muscle tissue in your leg, or the bone tissue in a particular bone, any skin tissue, all tissues, they receive their own blood supply. For example, the kidney that is receiving blood from one particular artery, renal artery, is one that is supplying it to the kidney. Likewise, we have femoral artery that is supplying to the upper part of thigh, and the popliteal artery that is supplying to the calf muscles. So we have this artery supplying blood to the tissues, and the actual exchange takes place with the capillaries. Arteries, smaller arteries, and still smaller arteries are called arterioles. They end up in capillaries. Capillaries form again venules, and they become veins. If you look at the structure of artery, and for that matter venule, both are same. They are made up of three layers. The innermost layer is called tunica intima. It is essentially made up of endothelial cells. It is single cell thick. So the interior part of the artery is made up of endothelial cells. It is called tunica intima. It is single cell in thickness. On covering this endothelial lining, there is tunica media, which is made up of smooth muscle cells, and there is tunica externa, again the basement membrane that is covering with the connective tissue and all. We call this as tunica externa or tunica adventitia. Both are same. So here, if you look at the artery, the pathology that can happen to the artery or arterioles is arteriosclerosis. Sclerosis means hardening. Thickening of media is what happens in arteriosclerosis. Why we need to understand this is, when we look at the patients of hypertension or ischemic heart disease, the main culprit here is the tunica media, which gets thickened, hardened, sclerosed, or it is like becomes very stiff, and it will not allow the smooth flowing of blood flow. And there is another kind of sclerosis, we call this as atherosclerosis, because of formation of erythematous plaque. Erythematous plaque is fat deposition in the inside of under the layer of endothelium. We call this as atherosclerosis, formation of erythematous plaque. Okay. Now the arterioles, they end up in capillaries, as I said, if you look at the tunica intima, just go back a bit. Yes, the tunica intima, it is made up of endothelial cells. When the artery is becoming arterioles, it becomes smaller in size. I mean, the muscle will go off gradually, and finally there is only a basement membrane left without no muscle, and the endothelial. We call them as capillaries. So there are some gaps between these capillaries and the fine connective tissue covering, which is called basement membrane. So here the actual fluid exchange takes place. The structure of veins is also same as that of veins, but only thing here is the tunica media is not that big or strong. So it is thin compared to that of arteries. So they actually they don't what you call, like, there is no pulsatile movement of blood in veins. When you look at any vein, you don't feel any pulse, but when you touch the artery, we see pulsatile motion of blood, because with every beat there is blood that is moving. Okay, these veins, since they collect blood, and it has to be a unidirectional flow, and heart is collecting all the blood, it is provided with valves so that there will not be any backflow to the tissues. The site of origin of veins is tissues. From tissues to heart is the direction. Okay, right. From tissues, it is going to the heart. It should not come back. Say, for example, the veins that are starting in the feet of an individual, they are moving against gradient, that is against gravity, towards heart. While doing so, it may so happen that the blood may actually fall back because of gravity. To prevent that, we have valves. And when valves are damaged, it leads into varicocele. That is, the veins are filled with blood and they become tortuous, and there is no actual coming back of blood to the heart in right quantities. So this is the functional anatomy of veins. So we need not go into the complete details of these veins and etc. We'll see only the functional aspect. I mean, how it is related to our practice. Now let's see physiology of heart. The function of heart can be summed up through cardiac output. So it is to pump blood, essentially. And failure, in this context, you need to understand inability to perform its function is called failure. So if a patient is suffering with heart failure, means his heart is not able to pump blood to the tissues. So what will happen with then? The tissues will not receive their nutrients and oxygen. Okay, this is failure. Don't get confused with cardiac arrest or heart attack or myocardial infarction. We'll come to that later. They all may lead to heart failure. Okay, essentially failure means not able to do its job is called heart failure. Same is the case with kidney failure or liver failure. What happens in kidney? The purpose of kidney is to filter out waste material, metabolic waste material, and send it out of the body through the formation of urine. When there is no urine output, we call it as kidney failure. In the same way, when there is no cardiac output, we call this as heart failure. So what is cardiac output? And to understand cardiac output, we need to know about these three terms. One is stroke volume, heart rate, and blood pressure. Amount of blood pumped by heart in a minute is called cardiac output. We all know that heart beats for about 70 to 90 times in a minute. So amount of blood pumped by, let's see here, let me be very clear. Amount of blood pumped by left ventricle, because it is the left ventricle that is actually pumping blood to the complete body. Pumped by left ventricle in a single stroke is called stroke volume. With every stroke, it is sending some volume, right? And heart rate is number of times a heart beats per minute is heart rate, or commonly known as pulse. So when you multiply these two things, that is stroke volume with heart rate, is called cardiac output. That is giving you amount of blood pumped by heart in a minute. It will be much clearer if you go through an example. Let's say there is 70 ml of blood that is pumped by the left ventricle and the heart is beating at 72 beats per minute, the net is close to 5000 ml of blood, or 5 liters of blood in a minute. So in a minute, heart is pumping out 5 liters of blood. This is a cardiac output. So what are the factors affecting this cardiac output? There are three. The first one is preload. Preload is amount of blood in left ventricle. If the blood that is there in the left ventricle before the actual beating of heart is less, the cardiac output will be less. As simple as that. Okay. The next thing, I mean, in another case, if the in the left ventricle, the amount of blood that is there in the left ventricle is more, this happens in two cases, either in beriberi or anemia. When the blood volume is more in a person's body, the preload will be more and the cardiac output is more. And the second thing is the contractility of cardiac muscle, how strong the cardiac muscle is. Let's say if a person is young, healthy and having good heart in the sense heart working in healthy manner. So contractility of cardiac muscle is also another factor that is affecting the cardiac output. In older people or people suffering with any kind of disease to their musculature of this ventricle, this happens in left ventricular hypertrophy or cardiomyopathies. Cardiomyo is muscle of heart, that is cardiomyopathy means any kind of disease or like is called pathy. Cardiomyopathies, what happens? The left ventricle's contractility is compromised, so the cardiac output is affected here. And the most important thing of all is afterload, that is peripheral resistance. What is peripheral resistance? The resistance offered by the musculature of the smaller arteries and arterioles. See, if you look at the heart, the big tube that is coming out of left ventricle is aorta. It is branching out into smaller arteries, from there into arterioles. If you look at the total surface area, it is huge. So if there is a small constriction in this diameter, it is offering huge resistance to the cardiac output. Okay, the resistance offered by this peripheral blood vessels is called peripheral resistance. If it is more, the cardiac output is less, is it not? Because the heart has to do a lot of work, right? We'll come to that when we see failure. You'll understand, you'll able to appreciate it better. So this is the physiology of heart. Let's see the physiology of vasculature. Arteries, arterioles, they offer peripheral resistance, and we'll see what are the factors that are affecting the vessel wall. We just discussed there could be vasoconstriction. If the vessels are contracting, what are the factors that are making them contract or become stiff? We will discuss those things. Venules and veins, what is their function? We know it is simple. And endothelium, why endothelium is so integral in the pathogenesis of heart disease and rest of the vascular pathologies. And finally, what are the neurological and hormonal control on this vasculature? Neuronal and hormonal control, the vessels, arteries in particular, are innervated by sympathetic nervous system. If you see, the nervous system is basically, there is peripheral nervous system, central nervous system, and there is autonomous nervous system, which means this is not under our control. Okay, let's say all the visceral organs like lungs and the structures in the lungs like bronchi and rest of the trachea, all these things, and coming to heart, liver, your stomach, kidneys and intestines, all these internal organs are innervated by autonomous nervous system. And we all know autonomous nervous system has got two branches, sympathetic and parasympathetic. So the blood vessels also are under direct control of sympathetic and parasympathetic. When there is a sympathetic stimulation, they release vasoconstrictors. The most common being adrenaline and noradrenaline. And there are vasodilators. These are the substances that will dilate the vessel wall. So if the heart were to function effectively, we want a vasodilation. I mean, we want larger lumen so that blood will flow smoothly. Okay, the sympathetic is the main neuronal control on blood vessels. Say for example, if you are anxious or like if you are stressed out, means what? There is a lot of sympathetic activity going on in your body, right? That will release adrenaline and noradrenaline, which are essentially vasoconstrictors. They narrow down the lumen of the vessel wall, and in return, they will increase the blood pressure. Okay, the vasodilators, there are so many vasodilators like 5-hydroxytryptamine, serotonin, and we have EDRF, endothelium derived releasing factor, and most of the vasodilation and vasoconstrictor activity is locally mediated. That means if there is an inflammation at a particular tissue, okay, the local vasodilators are released and they dilate the blood vessels rather than being under central control. The vasodilation most of the time is under the local hormonal activity. Coming to the blood pressure, what is blood pressure? If this is a blood vessel, cross section of a blood vessel, it is the lateral pressure that is exerted on the walls of the vessel. If you see when the blood is moving and it exerts some pressure on the vessel wall, right? When the heart is contracting, the more blood is coming, so it needs to expand, and when it is relaxing, it will come down. So the systolic pressure is when the heart is contracting, the maximum pressure that will be there in the blood is called systolic. When the heart is relaxing, the pressure that is there maintained in the blood vessel is called diastolic pressure. So there is blood pressure maintained in each and every individual, okay, but if it crosses the normal range, then only it is called hypertension. So blood pressure is normal, hypertension is abnormal. So what is the function of this vasculature? Perfusion with what? The blood. So the blood should go to all the tissues. This function, heart is actually pumping, vessels are the carriers, so they are like roads. So the perfusion, the traffic of blood is maintained by this particular vasculature. To understand the function of this vasculature at a cellular level, let's understand the concepts of diffusion and osmosis. Take a beaker and one semi-permeable membrane, separating this beaker into two parts. And the semi-permeable membrane, it says that it will not directly yellow all the substances through it. It is selective in yellowing the passage of the substances that are there on one side to the other side. So it is selective in yellowing the constituents of the liquid. So here, if you look at the beaker here, the concentration of this ions, let's say we call them as hydrogen ions or sodium ions for that matter, are more on this side and less on this side. Okay, this cannot be the case. I mean, the body has to maintain always homeostasis, that is balance. To achieve this, what should happen? We have around 10 molecules of sodium here. There are none. So how it will be balanced? If 5 from here, the gradient is towards this side. That means the concentration is high on this side and less on this side. So these molecules, they move to the opposite side. Now it achieved a state of homeostasis. Okay, this is a simple diffusion from a higher concentration to lower concentration. And there is another kind of movement of these ions and solutes. We call this as osmosis. So here again, if you see on one side, let's call them as protein. I mean, these are bigger proteins. The protein, the semi-permeable membrane will not allow movement of proteins from one side to another side. Here, the proteins are more in number, so they are high in concentration on right side. less here. Ideally speaking, the diffusion should allow some of the protein molecules, if they cross over the semi-permeable membrane, then our purpose of homeostasis is achieved. But the semi-permeable membrane is not allowing. So how do we maintain balance? If you look at, let's say we have 5 liters of water here, and each molecule has got 1 liter of water per molecule. But here you have 10, I mean 6, 7, 12, 12 molecules of protein, but this water is same. So this is not balanced. What should happen now? The water is in high concentration, right? The water on this side is in high concentration. So water should move out. So to achieve homeostasis, the movement should be, the water from this area should go to the other side, because semi-permeable membrane is not allowing the proteins to move in the opposite direction. By moving water from this side, then it will achieve balance. So it will suck up the water from the other side and the water level will raise. Okay, this is called osmosis, right? Why we need to understand this? Because let's say this is a cell membrane. Okay, the proteins are in high concentration, the water is on the other side. So the proteins, what they are doing, they are pulling the water. That is why the osmosis, the pressure with which the protein is pulling is called osmotic pressure. This is how the body maintains the exchange of nutrients and gases between the blood and the tissues. Now, how the cellular exchange of nutrients and oxygen takes place. This is a capillary. As you can see, it is single cell in thickness. Okay, this is an arterial end. This is an arterial end, and blood is moving in this direction from arterial end, which is bringing in high concentration of oxygen, to the capillary and to the vein, ending in the venous end of the capillary, which is high carbon dioxide, with high carbon dioxide concentration. Now, since the blood that is coming into the capillary through this arterial end is in high oxygen concentration, it is shown in pink. From there, it is mixing with the bluish carbon dioxide rich venous blood, so it is a bit purple color depicted here. Now, this is the interstitial tissue. Interstitium, this is called. On either side, we see the cells. Let's say it can be a liver cell, or like you take any cell, or a skin cell, or whatever, skin tissue, any tissue. This is the actual micro level picture. Now, the oxygen concentration is here high, which is very less, because the cells, they utilized all the oxygen that has come earlier. So the oxygen will move out and the glucose will move out with simple diffusion. And the cells, they utilize this glucose and oxygen, the carbon dioxide is released and some metabolic waste, and they are sucked into this venous end. The blood, after releasing all the oxygen and very less carbon dioxide here, so the carbon dioxide is more here, so it is going inside with simple diffusion. Right. Now, what about osmosis? If you look at the proteins here, and through the gaps between these endothelial cells, most of the smaller proteins, they move out along with the glucose, so many amino acids and all these things. According to the gradient, they move out. Here, the cells collect whatever they require, and while going away, the bigger proteins that are there in the venous end, what it will do is, here the protein is more and water is less, so it will pull all the water back into the venous end, right? So this is how the protein maintains the osmotic pressure. By maintaining osmotic pressure, is able to help in cellular exchange of nutrients. Okay, now, okay, let's go back a bit. Now, if the blood is coming with lot of force, right, or the blood is very low in plasma proteins, what will happen? The venous end suffers. I mean, the water that is going out is not coming back effectively. That is like one case in hypoproteinemias. The water is there lying in the tissue fluids. Okay, it is not coming back to the blood. So when the tissues are filled with a lot of fluid which is not coming effectively into the venous end. So accumulation of this fluid in the tissue spaces is what we call edema. One thing. Second thing, when the venous clearance, that is, the blood is not moving effectively, right? So this will move out only when we are doing some kind of movement, because the muscles in the legs will pull up all the venous blood that is there here in the tissues. We call them peripheral pumps. We'll come to that later. What will happen, say for example, if somebody is sitting for long hours, it usually happens in people sitting in the long distance flights or traveling overnight in the bus, sitting and without moving their feet, what will happen? We see swelling in their feet. This is happening because the fluid is there inside this particular interstitial fluid. It is not coming back to the heart effectively. So how do we get rid of this edema? The moment they start doing some kind of physical activity, right, all the fluid will be again sucked up back into this venous end, and from there it will go to the heart. Again, the circulation is maintained. And another important thing why we need to understand cellular exchange of nutrients is talk about hypertension and talk about sodium. If there is sodium, high sodium in the capillary compared to the sodium that is there in the interstitium and the cells, okay, so to neutralize this, what will the body do? It will send out all the water into the blood vessel. Got my point? The sodium is high in the lumen, it is less in the interstitium. If a person is eating a lot of salt and things rich in salt, it is sucking up water from the tissues into the circulation. So the volume of blood increases. And if you go back a bit, when volume of blood increases, it increases cardiac output. When cardiac output increases, it will increase automatically BP. That is the reason why we ask people to avoid high salt. So we'll see about it in hypertension. For now, to conclude the cellular exchange of nutrients, there is one more part, lymph. What is lymph? So blood consists of RBC, WBC, platelets, proteins, nutrients, and metabolic byproducts or end products. But the lymph is from artery. Once the fluid from the plasma from the blood is going out into the tissues, not everything that is going out is coming back into the venous blood. There are some kind of proteins which will not be coming back immediately, okay, with the venous blood. Whatever is left out is called lymph, and they have separate tracts to go back to the actual circulation. It is drained by lymphatic. Let's see what lymphatics are. See, here, from here, all the arterial blood is going out. I mean, the constituents of blood are going out into the interstitial fluid. Here, the exchange of nutrients and other things, it will happen. And all of them are not coming back into the venous end to go back to the heart. Only few things are coming. Whatever is left, they are collected by separate channels. Okay, this green line is called lymphatics. They form like loose endothelial cell lined tubes, these lymphatics. What they'll do is the tissue fluid that is there, I mean, if there is a damage to the cell debris, the bacteria or some other things, some bigger molecules which are not able to move back into the venous end, what they will do is they go through the lymphatics and finally they empty themselves into the heart. Okay, right. These lymphatics, again, as I said, they're lined by endothelial cells, but they don't have the complete tunica adventitia. That is, the basement membrane is not complete. And these lymphatics, since they are not coming through the main channel, that is veins, there can be so many things that can be come through lymphatics. So they are frequently guarded by a specialized structures called lymph nodes. We'll see it. We'll see more about it in immunology. To understand the actual functioning of vasculature, let's see and see it as see with an try to understand this with an example. Arterial blood is a supply struct. It is bringing you food, gas, oxygen, whatnot, everything. And capillaries is a market. The supply struct is bringing all the goods to the market where exchange of goods takes place. And venous blood is a garbage truck. Whatever, once it is emptied, it is collecting all the waste from that particular market. So people, in the sense, the cells in the tissues, in the presence of capillaries, they collect whatever they require and they throw away what is waste product or a byproduct of metabolism into the venous blood. And now, what is lymph? Lymph is leftovers. Okay, they are collected by another set of vessels. They are country roads. Let's say this is a main road. Artery, capillary, venous blood is a main road. But the lymphatic vessels are like by roads or bypass roads or country roads. Okay, and lymph nodes are like checkposts. Okay, right. So the applied aspect of it is, if you see, I mean, we finished both anatomy and physiology of heart and vasculature. The applied aspect of it is, most of the heart patients, they'll be put on these common medication, diuretics, beta blockers, calcium channel blockers, ACE inhibitors, or angiotensin receptor blockers, ARBs. But at the same time, before going to any of this, there is something known as lifestyle management. Okay, that means patient needs to maintain ideal weight. They need to take balanced diet or DASH diet, salt restriction. They should be doing some stress relieving activities like meditation or walking or some kind of exercise, physical activity, and they need to detoxify themselves on a regular basis. So we'll see in detail how do these things actually help in cutting down on the medication. You see, the whole purpose of this class is we need to educate our patients what is happening to their body, instead of just taking diuretics to control your hypertension. There are so many things in this. By doing this, you don't have to take medicine, which is more, first of all, is expensive on your body and offers a lot of complication and is not a permanent solution. Okay, so the applied aspect of this particular heart physiology, I mean anatomy and physiology, is how to make use of these things, and by relieving anxiety and stress, how we can control the usage of or minimize the usage of drugs. So this is the applied physiology. We'll see more of this in understanding, I mean in the discussion on hypertension.